Hey, I'm Dr. Jerika Dodd, founder and CEO of Your Pharmacy Advocate and executive editor of Pharmacist Magazine. Have you seen the magazine? Okay, that's not why we're here. We're not here to talk about the magazine, not on this platform. However, we are here to talk about something that's really good. It is the Women in Pharmacy Nothing Held Back virtual summit that's taking place July 21st through the 24th. And I am so excited that this lady is joining me because she didn't know she was going to be joining me. So I want to welcome, and I'll tell you how we got connected and all that. We're going to tell you all of that. But I want to welcome Meredith Ayers to the platform and say thank you, Meredith, for being my guest today on the live, but also thank you for coming alongside and being a sponsor of the Women in Pharmacy Nothing Held Back live virtual summit. Welcome.
Thank you so much. I'm excited to jump on and excited to be a part of your event and excited about how we met.
Yes. All right. So let's not keep them in suspense any longer. Let's tell them how we met. We met because I had been working with another technician who had volunteered to be a sponsor of the event. And that technician since had some family emergencies to arise and was no longer able to be a part and participate. And I was like, I need a technician. I need somebody else. And so it was amazing because when I got the message that she wasn't able to participate this week, you saw a post that I had posted online. I think it was on LinkedIn. And I think you commented on the post or shared the post or commented.
Mm-hmm.
And I saw it like in the notifications. And I was like, wait, hey, you, let me talk to you. And so literally you couldn't hear me talking to my phone, but literally I was yelling like, wait, what's your name? And so I responded to the comment that you put on the post. But then I also went and sent you a message, a private message, and said, are you a speaker? Are you an entrepreneur? I knew that you were a pharmacy technician. And then I said, can you call me tonight? Now, I know that that was probably the weirdest thing. So tell me, like, what were you thinking when you got this random message from me?
I was thinking I am in Las Vegas as we speak, out of my time zone. And I'm thinking I'm here in Vegas doing a talk, very much along the lines of, a vision I had. And that opportunity came up and I thought, since COVID, I've decided to take every opportunity that comes along that makes sense. And if it turns out it doesn't make sense, it's not for me, but I called the phone number, I called you, and immediately within 5 minutes, it made sense. I think we were on the phone for about a half hour or so, and I was like, that was the most intense and exciting phone call I've had in so long, because it was a discussion that I've been having in my head and with my husband, and let's do it. So I'm excited you reached out, and I'm excited that the planets aligned.
And so I'll tell you, that's one of the things that I say to women in pharmacy. So I have this whole group, Women in Pharmacy, What's Next? Because usually when a woman in pharmacy, either I'm speaking pharmacist or pharmacy technician, has the thought of, I don't know that I feel fulfilled in my job. I don't know if I really hate the place. Some people are at that point. Other people are like, I kind of want to know what else there is. I want to do something different. That's when I get the calls. And then sometimes when I'm talking to pharmacy students, they express their anxiety over looking at the profession and like, what's to come when I graduate? Is there going to be a job for me? And so then they have a different set of pressures and anxieties that they're dealing with. However, one of the things I talk about is opportunity. And so I think it's definitely important to be aware of your surroundings and to know if, it's time to move on or do something new or look for something new. But I think just being open to opportunities. I did not realize that I was going to need an additional sponsor. You didn't realize I was going to need an additional sponsor, but I called and I thought all I have, you miss 100% of the shots you don't take. So you know what? I'm just going to take a shot. I'm just going to reach out. I mean, from what I could see really quickly on your LinkedIn profile, it looked like you were, doing your own thing, or at least getting ready to. And so I was like, okay, well, let me just try. Let me just see. And I'm grateful that you said yes, because I think it's going to be a fun experience for you. And I think it will also be very inspirational for the people, if you even think beyond those who are going to attend, but those who will see this video next year and go, what? The event's happening again, because we will do it again. And they will see this and go, well, that is possible. So I can do, because oftentimes I think that it's not that people have a lack of dreams or hopes or ideas, it's they don't really believe they can do it. So talk to me a little bit about that.
I think the biggest issue with me was I was in my own head. And it took a pandemic for me to get out of my head. When you stay in your head for that long, it's pretty lonely and pretty crazy. And I thought, okay, we're going to get to the point where we're going to be able to be around people more. I'm going to take those opportunities to network. I'm not going to hold back on my content and my conversations. Worst case scenario, they're not interested in what I have to say, and that's fine. But there are plenty of people I've realized that are interested in what I have to say. This past trip I just had was a great example. Many important conversations with pharmacy owners, new pharmacy owners, old pharmacy owners stuck in their old ways, and they've never thought to communicate with the rest of their staff for ideas, and I'm that person for them.
Right.
I speak from experience. I have worked for independent pharmacies for over 20 years, and I can tell you almost every aspect of each kind that there's something that all of your support staff can offer. And I realize in conversations at these networking events, people want to listen.
Megan, let me just let you in on who is watching us thus far. So we have Chris, who said, great topic. My daughter is a pharmacist and in 6 months will be a veterinarian from Tuskegee. Congratulations,
oh, wow.
Chris. Congratulations to you and to your daughter. We also have a message from Christine, and she says, hey, Meredith, what a pleasure to see you. This is Chris from CPESN. So look, people are already watching, Meredith. I knew this would be the case. And so I am so grateful that when I called you, when I sent you that message, was like, here's my phone number, because I don't get my phone number out often. I was like, okay, we do not have time to like take care of all of this texting back and forth, and, through Messenger on LinkedIn. So I was literally like, okay, can you just call me? And so it was my pleasure that you said, sure, yeah. I mean, like, let me see what she's talking about. And because I wanted so much, I think I said to you before we went live that oftentimes technicians have said to me after I've had events, well, we thought it was only for pharmacists, or I thought it was only for pharmacists. And I'm like, no, you are welcome. So I really want technicians to know that even though I say women in pharmacy, it's for everyone. You don't even have to be in pharmacy to attend. Someone asked me that earlier today. You don't have to be a woman. You don't have to be in pharmacy. You can attend. If you are ready to grow, if you're willing to take a look at your mindset, examine it, determine, how am I getting in my own way? Like you said, I was in my head a lot. And because of the pandemic, I think we all definitely spent a lot of time in our head. So you literally, you said I was in my head. So that's what we're going to do that day one. We're going to look at what are the things that we think about that trip us up and get us all in our own way and get us over analyzing things. And then that second day, we're going to look at whether you're a pharmacist, tech, or student, or none of the above, what's in your hand that you can turn into something that's valuable to other people. Many of us look at our hands and we go, I don't have anything. You've got more than you think. We all have a set of skills and knowledge base that we take for granted, that everybody knows that. And even if everybody does know it, they're not using it to further their career or monetize it or what have you. So that's what day 2 is going to be about. It's going to be about business building, but not like okay, you look up the Secretary of State and go file for your LLC, not that kind of business
Right.
building. And then that third day, we're going to talk about marketing yourself. Like you said, who's going to listen to me? Well, you know what? A lot of people listen to me, and I'm grateful for that because, and I don't claim to have all the answers, but I have some answers and I have some solutions. And I've determined that for those who are for me, I'm going to share them. I'm going to keep, and they're listening. People are listening. So people obviously are listening to you. People are listening to me. And that I did a post talking about that's what one of the 10 things that women in pharmacy say to me is, who's going to listen to me? You would be surprised at who's going to listen to you.
And you don't realize women in pharmacy means not women pharmacists necessarily. So we've got technicians, we have drivers, we have clerks,
yes.
we have office staff. We're all in this boat, and
right.
we have something important to say. We all have something to offer.
Yes, we all, I believe, were put here on this earth for a reason. And my reason was not for me to become smaller and fit in a mold that someone else had for me. My reason wasn't to get to a dead end in a career and then spend the balance of the years that I was going to work, in that dead end career. And I'm not saying I did not feel that way about my career, but there are people who do. That's not our purpose on this earth, to just get to a stopping point and just wait and just tread water until we're 65. Like right. That's, nonetheless, I'm so excited because what I think is possible when people just take a moment and they step away from their everyday and they allow themselves to dream. That is one of the things that I am most excited about, because oftentimes in the hustle and bustle of life, we don't get to stop and sit back and go, I wonder what's possible. Tell me, what do you think about that?
So I have an analogy I've used for the past year or so, and it's going to refer back to everybody's geometry skills. But I've decided to not be a segment, mm-hmm. which has 2 points. There's a beginning and an end. Mm-hmm. I've decided to be a line, mm-hmm. which, if you know the geometric term, mm-hmm. it's ongoing. There's no beginning or end. Right. So I've decided that's what I'm going to do. That's, if you catch me on the phone or just working on something, I will start doodling a line, mm-hmm. and I'll scratch out the segment. So that's what I've decided to do. And that's my example of opportunity to make a splash in whatever I can and whoever needs my help with my experience.
Right. I like that. A segment versus a line.
Now everybody's going to go Google geometry terms.
Right. But I totally get it. It made sense when you said it, because you're right. A segment has a finite beginning and a finite end, mm-hmm. and it's like a point A to point B, but a line is continuous and it does not end. I like that. And you know what, Megan? I believe that I have shirts that say, and I believe, I could definitely have them say, everyone needs a pharmacy tech. But I believe that everyone needs a pharmacist. And the reason why, and what that saying is meant to mean is that because there's so many things that we can do. We don't have to just do the thing that people associate us with doing. Like, there are many pharmacists who are coaches. There are many pharmacists who are wellness practitioners. There are pharmacists. I did a post last evening about the different women in pharmacy that have come and worked with me and what types of ideas that they have wanted to give birth to. And yes, some of them were pharmacy related, but a lot of them were not. Well, I am believing the same for pharmacy technicians, that there are so many things that pharmacy technicians can do that is outside of the scope of what you would normally think of, mm-hmm. that it's kind of like the sky's the limit. Like, so why not? And I believe there are enough things to fit the personalities of people, the things that people are interested in, that one of the things I said is that if I were a technician and I were looking to do something new, I would look at all these pharmacists who have become entrepreneurs and say, do you need a technician to work with you in your business, or even if they didn't work as employee-employer, but contract business to business. The
Right.
technician's business contract with the pharmacist's business. I remember when in my consulting practice, I was taking care of patients and would have loved to have had a technician do the initial interview with the patient to get all of the information, to go over the forms that they had already filled out, because we know that recall can be a challenge. And so someone may think they gave you all the information, but then when you're talking to them, they go, "Oh, I forgot to tell you, I've done that. I did that just a couple of weeks ago in the doctor's office." I was like, "Oh, did I forget to tell you about that surgery? I should have let you know that." And so, like, I think of the ways that a technician could have helped me when I was doing more consulting of patients, because it would have been so much more freeing to free me up to do other things to serve the patients if I had had a tech who could do some of that triage and gathering all the history and past medical history and medications and all of that. And not only would that person be beneficial in a role like that, but they already know those things. Like, they're already, it's not like you have to go and go, okay, let's talk about medical terminology and let's learn drug names. That techs are very already like in that place, so they know it. So if this is a tip to all the techs, I would call up some of these pharmacist entrepreneurs that you see and brainstorm what's possible about your business working with their business in order to help them carry out their mission. I think of all of the things that people could possibly call them and say, "Do you need a person to design graphics?" Because a person to design graphics compared to a person who has no medical or pharmacy background designing graphics, two different
Totally
things.
different thing.
But someone who already gets you, because so that's why I say I have those shirts that say everyone needs a pharmacist. I believe that there was one that said everyone needs a pharmacy tech. It's true, whether they're doing traditional activities or something totally out of the box.
Right. And in whatever scenario you're in, they're cogs. And if you throw something into that machine that stops the cogs are your technicians. You can't take out the technician and it work appropriately,
Right.
no matter what the scenario is. If it's retail or if it's a business scenario or, whatever that may be, it doesn't work without all the pieces.
And you know what? Let me just say this, because as I mentioned to you before we went live, it's been a while since I have practiced, but I do still maintain my licenses. And as I said to you, when I was doing PRN work, and even I don't know that I shared this with you, but I used to manage a hospital pharmacy, and the techs would be like, "Boss, you come to work and you're dressed in scrubs just like we are." Yeah, because we were all on the same mission. We all were looking to work towards the same outcome. And so, I've been asked time to time my thoughts on pharmacist technician relationships. And I'm a bit more removed because I don't practice anymore, but I've heard, interesting things. And I think that there's a place for everybody in this healthcare system, in this ecosystem of business. Like, I'm not really one for jockeying for positions or for turf wars or things like that. I believe that there's a place for technicians, there's a place for pharmacists, there's enough room. So I wanted to bring that up too, because from time to time people will comment to me, pharmacists and technicians, and I just never have been one to subscribe to any type of we them, if you will, because I believe that we're all called to do a job and a role in where we are. And I believe that having everyone perform that role at its optimal level is going to be the best for all involved.
That's when it works the best.
Yeah.
And I've been so fortunate to have mentors that were nothing but the best, but I know that's not the case for everybody.
Right. And that was why I really wanted to make sure that techs understood that this conference is a place for them. What I have to teach is content for them, and even down to the sponsors they were chosen with all of the audience in mind, not just pharmacists. Obviously, I am a pharmacist, and I may speak quicker to things that refer to pharmacists, but it doesn't necessarily mean that I'm excluding anyone. That's what I am, and that's what my profession is. But I really do believe that when we talk about overthinking, there are traits that it doesn't matter if it's pharmacist or technician, we find them in common. And so I think we were talking before we went live about overthinking. I think that that's a human trait. I don't even know that that's a women in pharmacy trait. Overthinking.
Overthinking. I like to call that shower talks. When you're in the shower and you're just, oh, I should have said something different.
Standing
Oh,
there.
I could have really said this in that argument.
Yes, when you're thinking about it after the fact. I do quite a lot of thinking in the shower, and like playing out the whole scenario, thinking about how will this work in the shower. So I've got to watch that water usage. Nonetheless, can you talk a little bit more about what you do? Because there are people who are thinking, what can I do next? How do I even get started? I feel like I'm boxed in into this one place, this one job. If you could give the people, what's the first next thing, or the first thing that you did, tell us.
So defining myself, I'm a button pusher by nature. If it doesn't work, I'm going to push a button, see if it works. That works for some people, that doesn't work for others. But I've also, like I mentioned, have been fortunate to have mentors that recognized that I was the button pusher and didn't rein me in, just redirected me. And I've learned how to do that to others now, realizing how it affected my skills and my career. I have technicians that walk by and say, well, I'm just a technician, I can't do that. I immediately have to stop the conversation.
Yes.
And how about we not say the word just?
I hate that word. I'm just.
I agree. And I do it with our delivery drivers. They were like, I'm just a delivery driver. I'm like, we're not delivering pizza here.
But even if you are delivering pizza, you're not just a delivery driver.
Not just.
You're put here for a purpose.
The word just is a bad word. So my move to what I'm walking into now has been curated by a lot of different influences. Professionally, I've had the mentors. Personally, my husband is my biggest fan.
Aww.
And I've had other people in the industry reach out to do other things. And I realized in networking conversations that, wait, I have some of the answers that I didn't realize other people didn't have.
Yes.
And I want to help other people. Like, this is why I'm here. I went into pharmacy to help patients. And now I realize I can help other pharmacies help other patients that I can't reach. So that's the beginning, and we're going to take it from here and see where it goes.
Talk to me a little bit about when you make a decision that you're going to go in said direction, but everything in your mind is like, can I do this? Will they listen to me? Is this going to work? How do you keep going forward despite all the things that your brain is saying? I said in one of the lives yesterday, I said, don't let your brain edit what your heart is screaming that it wants. And so oftentimes I think that gets us, and we go, oh, well, who am I to do this? Who's going to listen to me? How's that going to work? What's my spouse going to say? What's my family going to say? What are my peers going to say? How do you hear all of that noise, internal chatter, and still move forward?
So the previous version of me wouldn't have. I would have been like, okay, I'm here, I am in my comfort zone, and I'm perfectly okay doing that. And I don't think there's anything wrong with being comfortable with what I'm doing, but I knew that I wanted to do more, that I had more to say. So take, for example, how we met. I never would have called a phone number sent to me over LinkedIn, but I did because I was like, okay, I've seen her posts. She's on the same level I am. She wants, she's on a much higher level than I am, but purpose-wise, we're on the same level. And let's do it. And I think age has really become a factor for me. I don't want to get to the point where I didn't share what I had to share.
Yeah.
And I have things that people can use. And it surprises me in the recent conversations I've had that people are shocked by some of the things I've said. And I'm like, it didn't strike me that was abnormal.
Right.
So
Yeah.
I started taking notes and putting these images in my head of a successful conversation. And it's been working really well recently. And as we get back to live events and interactions online and more of that, I'm getting feedback. I'm getting questions. Give me more of that. Where else can you go with this? And it's been rewarding. And I think there's more that I still haven't uncovered that I don't realize other people need.
And once people do associate you with being someone that represents the answers that they're looking for or the help that they need, then more and more people will see you. And you'll be amazed at the people that are meant for you. When I look across all of the coaching, I'd say 95% of my coaching clients, when I look across their names or their pictures, because I've got, video from coaching sessions, and I think about them all, in some way or another, a piece of their story is my story. Not necessarily verbatim, word for word, event for event, or experience for experience, but when you start walking in your calling and what it is that you were shaped to do, then people notice. And then the right people more than likely will gravitate towards you. Those who are not supposed to work with you, who are not a good fit for you, from time to time you may have them come along, but I have found it to be pretty a rare occurrence, because the way that I speak is to connect with the heart. And so connecting with those people who know that I get them and they can in turn get me. And there's, like I said, there's some parts of our story that it's like you can see a part of my story in all of my clients. And I think that that is one of the indicators of how you know that you are doing what you're doing your thing. You're doing what you were sent to do. And I know we talked before and I said, all this posting that I've been doing and advertising this event, I actually just really got over myself. I really did, because we will sit and not do something because in our heads we're overthinking and going, who's going to listen to me? What are people going to say? And all those other things that roll around in our brains. However, it's amazing when you become dedicated to something and when you're committed to something. You'll do whatever it takes. You'll be willing to look foolish. You'll be willing for somebody to say, no, I will not call this number and don't ever text me again, or don't ever message me again. Like, you'd be willing to say that, because I literally would have been like, okay, let's go on to the next person. So with that, I want to say I am so excited that we got the chance to connect. I'm grateful that you said yes. She said yes.
Yeah.
I'm grateful that you said yes. And I'm looking forward to you definitely being a part of the conference, but also a part of the VIP sponsor coffee on Friday morning, where those in the room, whether they're pharmacists, techs, students, they can ask you questions. They can ask, how did you get started speaking? How did you get, how did you go from, no one seemingly knowing you to all of a sudden now you were at a conference and you were just speaking? How did you do that? So I'm sure there will be questions in the room for you. And I would love, love, love for those who are sitting on the fence to hear some last words of wisdom. So if there's a woman in pharmacy, tech, pharmacist, or student, if there's someone who's not in pharmacy and they're sitting on the fence trying to decide if they're going to come, maybe they can only come for one day, but they can't come for all 3 of the days. Well, my answer to that is get the VIP ticket, because then they're able to get access to the replay, so they're not missing all the content. But outside of those, if people are just like, I'm not really sure, what would you say to that person about attending this conference?
What do you have to lose? Take the opportunity, grab it, utilize the resources that are right here that have been brought to you in one place. You don't have to go searching for it.
Right. Yeah, I agree that the room on Friday's coffee chat will have people in their areas of expertise that they have agreed to be there to answer questions, to have a dialogue. And I am so excited to offer that to those who are attending, because it's not every day you get that many people in one room and ask them, whatever you want. And it's not every day that we are putting ourselves in those types of environments that foster growth, that make you sit back and go, I had an idea, or I have an idea. That we don't, a lot of times we get so in the midst of hustle and bustle of the day that who takes time to set aside and dream? Who does that? So I'm looking forward to this conference being the place where people can do that. They can set aside, and think about what they dream about, what they want it to be, and then starting putting, a map in place so that they can get there. That's what I'm looking forward to.
Right.
I am so grateful to have you. As I said, thank you for saying yes. I look forward to you being a part, as well as the coffee chat. But then even further, because, one of the things that I stand and I talk about on my soapboxes is relationships. And so I look forward to the building of even further the relationship, because when I look to connect with people, it's not just to collaborate for one time and then, unless that's what the situation calls for, but how can I be of support to you, 5 years down the road, or vice versa? Because I would disagree that that whole levels thing. I don't look at it like that. I look at, here's another woman in pharmacy. Here's another human being. How can I support? How can I encourage? How can I, do whatever I can? So I look forward to that.
I do too, as well. I'm so excited you reached out.
Yes, and I'm so excited that you didn't block. I'm blocking this woman. I don't know who she is sending me this message off this random message.
It was meant to be.
Yes. And so I'm so grateful that even in the midst of you being busy at another conference, you stopped to take the time to answer. I mean, because it's not like you were sitting around twiddling your thumbs, waiting on me to send a message. So I very much acknowledge that you were doing your own thing and busy before I ever came along. So I appreciate that. And I want to just say, for those who are looking for more information on the event, I'll have it scrolling there on the screen for the last few seconds. It's nothingheldback.live. Don't go to .com. It drops you off in a neighborhood you don't want to be in. Anyway, I don't know. I really don't know what happens, but it's not .com. It's .live. Women in Pharmacy, Nothing Held Back, live virtual summit, the 21st and the 23rd of July. Starts at 11 a.m. Eastern time each of those 3 days. Website, nothingheldback.live. There are tickets for technicians, tickets for students. There are discounts for anyone who's been a former client of the magazine or a former coaching client of mine. So please, please, please make sure that you head there, get your tickets, because just RSVPing on LinkedIn does not equal you attending this conference. And, I have that happen sometimes where people don't necessarily read all the information. And then on the moment of the day of, they're looking for the link. And it's like, you have to register. You have to register. You have to register. So just clicking yes on LinkedIn is not the equivalent of registering. You want to go to nothingheldback.live so that you can get registered. All right, Meredith, thank you 1,000 times. I can't wait to see you later this week, and it's going to be a lot of fun.
I'm really excited.
All right, we will, let's see, hold on. We've got a comment. Let's see what else somebody said. Oh, Christine left us another comment. She said, Jareka, thanks for this moment of synchronicity. Oh, you're welcome. Christine, I hope we're going to see you there at the conference. Thank you for watching. Thank you for tuning in. And I am so excited to get to these next 2 days because it's going to all be happening. All right. So we'll see you in a couple days, Meredith, and thank you again.
Thank you.
Okay. Bye.